context in one project, like a member of COPASAH Europe. We organized this webinar, which we consider it very important topic, access to health through strategic action. And you can see there it's not only litigation, it's strategic litigation, and I will start with a few remarks of that in a minute. So our agenda, you can see, is shared by Darko. I start the webinar, then Darko will present briefly the project. We have invited Thomas de Jong from European Public Health Alliance to speak about the policies and how related the alliance to the strategic litigation. And then we'll have a QA session in the end. Uh, and maybe it's better to write it in the chat, and then Darko will read it and helping me to answer it in that session, the last session. So I'm Eugene Ghița. I am president of Roma Just, Roma Lawyers Association from Romania. We have our goals and objective for organization. It's mission and human rights from 2016 until now. And I told you I will speak a little bit about the litigation. When we speak about litigation, it's about justice. Justice, it's means court. Court means time and resources. But we speak today about strategic litigation because the strategic litigation, it's about the cases which it's on media, which is impact of population, where was bring it up by some I don't know, victims, or I don't know, some activists. So when it's the impact national level or regional level, there we speak about strategic litigation. It's well, when we speak about strategic litigation, actually we have a victim, and then we can speak also for the individual litigation. But for the resources for one NGO, it's too much to go for individual litigation one by one. So for that, we will speak today for strategic litigation about the big cases, and also I will present you cases which was solved in European Human Rights Court, and also where it's pending in court in Romania. So when I have my presentation, I will speak more. And now I will give the floor to Darko to present briefly our project and the context which we organized this webinar. Darko, please.
Thank you, Eugen. Hi all, I'm Darko Antic from the Association for Emancipation, Solidarity and Equality of Women. We are actually as organization, we are the secretariat of the COPASAH Europe network. So this webinar is part of our COPASAH Europe activities that are related to sharing experience from our members, and also also giving a space for other members and other organizations from Europe to learn about the topic that we are discussing. In this case is the strategic litigation. The webinar is organized by Roma Just as our member from the beginning, and the whole project and all COPASAH Europe activities in the last 4 years are supported by PI. I would like to mention, for those who are not aware, that COPASAH Europe was established in 2021, and we are a sub network to COPASAH Global, a network that exists for more than 12 years. COPASAH Europe is part of the global COPASAH network, includes also practitioners from Asia, Africa, and also Latin America. And our main mission as a network is to strengthen and promote collective knowledge, skills, and capacities of community-oriented organizations and health activists in Europe, and also to promote active citizenship that will make health systems responsive, equitable, and people-centered. What is the main goal of COPASAH Europe is to work on broadening the pool of practitioners who are part of the network, especially those who are coming from regions that are not covered with the existing members. Provision of opportunities of our network members to learn and share experience based on their needs. Also providing space for promotion of the results and also the work of the network, and also individual results from our members. Joint actions of the members of COPASAH Europe, and also giving a space for deeper connections with other practitioners from other regions that are part of the COPASAH Global. Thank you, Eugen, and hope we will have a fruitful discussion.
Thank you very much. So you understand how is our alliance group of COPASAH Europe. We have some projects, and the next year we're going further with our activities, and I'm sure the impact for the Roma population will be that we follow up in the next year. So now I will going to, according to our, we switch a little bit. I will go to my presentation, and then Thomas, you follow, okay? I try to share it my screen and to find the presentation. It's okay?
Yeah, it works.
Okay. So I will start it with some cases. We will start it with some cases from our organization, where we have it in 2023. Sorry, some colleagues here. So this case, it's very, I don't know, have a big impact in Romania this year, 2023. Roma woman was hospital to deliver, and the hospital didn't allow come in because they didn't have the department. You can see the slide here. And they was sent it to another hospital, bigger ones, regional, to 60 kilometers from there. Also, the woman has disability. She is deaf, and her mother and her brother was there in the hospital, and she didn't have any assistance from the services. The doctor didn't come out, and the nurse didn't give her attention, and that was happening in the context of it was nearly to the big community Bărbulești in Romania, and there it's 80% of population in our Roma population. So, when we was going there to document it and to see what was happening with the case, we found out about the access for health there. It's so difficult to implement it because they are Roma, and you know how is it in the hospital when someone is in the patient, going to the hospital, relatives, the friends, and members of family are going together. And for that, many times uh, uh, the hospital call police to come to protect the doctors. So in this context, they was aware, and they was calling also some guardians, some protecting, because they was afraid Roma members of family will coming to fight on them. Why they are not was not giving the access to treatment in the hospital. Uh, the video was public, and the victim was delivered on the ground, on the beton, near to the one wall, and she was filmed and put it on online, and shared it by many people, and was something viral also in European context. We are there with the lawyers, and we applied to the National Council of Combating Discrimination in Romania, equality body, and also to the prosecutor, because it was a crime, hate crime, we consider it. And also we monitoring the hate speech was coming in the article, because they started to speak about the film, the video, and people coming with comments. And even in that situation, when one lady delivered a front of the hospital, existed some hate speech, comments. Even from the mayor, he came and said something. Why she not coming before 4 o'clock afternoon? Because then we have the personal there. Why not to come in the night? And that is the specific Roma behavior, to come late and to come all together. And we have a complaint against the personnel from the hospital. We have complaint against the director, and also against the mayor. And now the procedure is ongoing. We have our proofs, send it, and we wait the case to be solved next year, because was national viral, and the impact involve also their ombudsman, and also Ministry of Ministry of Justice. They wanted to see what is happening with this case. So that means, like I told you in the beginning, the strategic litigation, because it's a viral, the impact it's a big, it's national and maybe European, and we are involved in that. We are also partner in this case, supporting us with resources, European Roma Rights Center. So I will tell you next other cases from the European Court of Human Rights, give it by um, ERC. So we have a case against Slovakia. Yeah, I can put it in the chat if you like. I will put it to share it, Darko. And there is cases of sterilization, obligate sterilization without the approval from woman. And we have three cases against Slovakia. You can read it, and you'll see how doctors decided to not allow anymore women to deliver it, because there are too many members in the families. Something like God, stop it, because social and economical situation from your family is not properly good, and how you managing to raise your kids in that condition. So we have three cases, and you can saw it in the site of human in its European court. So we have another case in Hungary, and the ambulance refuses to enter the mainly Roma village, and the woman died in Hungary. So we have another case, and this one is pending before the ECHR. So I don't know, maybe session of the Q&A, we will find also from news stories which it's happen in other countries about that situation. The ambulance are not going to the the villages where it's the population 80% of Rome. Another case, it's pregnant Romani woman. It's from that is from Macedonia. Maybe you know it about, and if not, I some details. So a woman died due to not getting proper medical attention in Skopje and Ohrid, Macedonia. So that case is again to the European Court of Human Rights pending, and European Roma Rights Center documented, and it also that case it's practically similar to what we have in Romania, and I was presented before, and we are waiting also some decision from the court. So that will be very impactfully in the countries member of EU, because when we have decision from the European court, then we will have obligation from the governments and parliaments to have it, to implement the decision, and that could be a very good impact for the Roma population. Another case is a woman lost her baby due to not getting medical care in hospital in Slovakia, and also in we have another case, Romani woman not having access to reproductive health care in Chuto Orizari. So also that cases, it's strategic because they came from victims and put it in the media, and that I told you from the beginning could be helping the association or activists or monitors of human rights and them's activity to use it in the court or in the litigation cases. So I gave you some diverse cases to understand what it happened in Europe, and for sure exists more cases when it come about access to help from Roma population, when we speak about insurance, because there is not so easily to have insurance, and maybe in the is different, but in Romania you have to be to have a job, have insurance, and for that the population are not going to access the health system because they think from the beginning will not be allowed to go there because I don't have insurance. Also, that is very important. And in Romania, we have a case on that documented, and we have a case in the court also about that topic, the insurance for Romani population in communities from Romania. So from my side, I think it's enough, and maybe in the eighth session we have a discussion about what litigation in the court, how we can, I don't know, to prepare the proofs, because it's very important that, and how can use the decisions from the European in our cases in the domestic system of justice. So I will stop it now, my presentation. So, and next on our agenda, I will invite Thomas to present us the activity of IFA and the small briefly about and maybe to make links to the strategic litigation, how it's in your strategy for next year. Please.
Okay, thanks a lot, Eugen. Yeah, I thank you very much for that presentation as well, as you said. Yeah, what I'm going to try to do with my presentation is to kind of fit that into a wider perspective, a European perspective on strategic litigation. Before I start, let me just also thank you for inviting me to speak here today. It's always a great pleasure to cooperate with COPASAH. I've done so in the past, and it's always been a great pleasure to talk about social accountability and also in this wider sense. And of course, also extending that thanks to the Association for Emancipation, Solidarity, and Equality of Women in Macedonia, North Macedonia, who we work with a lot as well. So thanks a lot for that. So let me just introduce myself first. My name is Thomas de Jong. I'm a policy manager for the European Public Health Alliance. And the European Public Health Alliance is a Brussels-based NGO alliance. So we consist of over 70 members currently across Europe, the European Union, but also in accession countries. And we represent the interests of public health civil society organizations, public health researchers, patient organizations, all kinds of different kinds of NGOs, civil society organizations that have some interest in public health. And together with them, we advocate to improve health and strengthen to strengthen the voice of public health in Europe. So we do that mainly in European Union advocacy, but also beyond, because as you will find out during my presentation, it touches on a lot of different sectors as well. What is also important to mention is that I work on the health equity cluster within the European Public Health Alliance. So essentially my work focuses on inequities between specific groups, marginalized groups, racialized groups, and how they are limited in their access to health, but also how their outcomes are changed, are different from other groups in certain countries. The way in which we do that is, on the one hand, through the Roma Health Network. This is something that a project that started a couple of years ago, in which we, together with Roma and pro-Roma NGOs, but also with researchers, we advocate specifically on health inequities faced by Roma. And then another network that I wanted to mention here as well is the so-called DISCO, Anti-Discrimination and Health Equity Network, that we have set up last year. This is a stakeholder network. So in this, we cooperate again with the European Commission, and we focus specifically on anti-discrimination, on anti-racism in health in the European Union. And it consists similarly of health actors that have some interest in combating racism and discrimination in health. But this is relevant today because it informs a lot of the work that I want to talk about regarding strategic litigation. So today I will speak very specifically about the link with European policy. I do not have a law background. I have a background in European policy. So what I'm going to be talking about here today is a bit more surface level, but I hope and I believe it should be of use to you, because it is, as said by Eugen today, extremely important to talk about strategic litigation when we are talking about public health advocacy. So a lot of this should not be new to you, but I think it's important to have it mentioned here. When we talk about public health in the European Union, and when we talk about how that might be relevant to strategic litigation, it's important first to mention that public health was not always a competence within the European Union. As of the Treaty of Maastricht in 1992, public health became part of the founding treaties. It can actually be read there in the Article 168 on the Treaty of the Functioning of the European Union, that it mentions there a high level of human health protection shall be ensured in the definition of implementation of all Union policies and activities. But what you can already see there is that it's not actually something that the European Union has a competence on. Health is a competence that remains very much on the member state level, and the EU can only complement that work, essentially. So most of the work that we do as a public health advocacy institution goes through the European Union, but the European Union does not necessarily have an explicit competence in health policy. That is something that comes from the member state level. So that puts us in a difficult position. The reality that we face in a lot of cases is that EU health policy is not binding. This leads to there not really being a system of accountability in place. The policy itself often being non-binding, and as a result, these policies are less decisive. They're a bit. It's more difficult to reach concrete results because we have a limited amount of tools to actually ensure that member states take action when it comes to public health policy. Again, I'm talking about this in very broad terms, but it's important to mention that because it has a large effect on how we do our work. To make this a bit more concrete, I wanted to give you an example of something that I work on personally within my work at the European Public Health Alliance, which is on Roma health. And I wanted to talk to you about the EU Roma strategic framework. So essentially a policy framework in place at the European Union level to ensure that there is Roma equality policy ongoing, that Roma inclusion is fostered in the European Union and beyond, also in accession countries. And just the strategy that kind of goes behind that. So the European Union has done this in the previous decade as well, but we're talking about the current decade, has started a new round of this framework in 2020. As part, it's also been established in a communication that is linked there on the slide. And within that strategy, the Commission sets goals for Roma inclusion. Now, on our part, when it comes to health, what is relevant there is that it has a clear goal. It says that the Roma health life expectancy gap should be halved. So currently, or in 2020, that gap was 10 years between Roma and the non-Roma, and that by 2030 should be cut in half, so it should be 5 years. That seems like a very tangible goal, and that seems like something that we can actually work with, also when it comes to litigation. However, as said, there is that problem of that being non-binding. So we do have Council recommendations from 2021, so from the Council of the European Union, that has given us clear guidelines on what member states should do to foster Roma health, to improve Roma health. It has given a long list of indicators that member states should try to foster in order to improve Roma health. So this directly involves the strategies that each member state and accession country to the European Union has to meet, or should, in theory, be working on to improve Roma health. But the problem there is, as I said, it's not binding. So what does that lead to? The result of that is that when you look at these strategies, and that is what we did with the Roma Health Network, you see a very scattered, an overall scattered approach to Roma health. So the slide that you can see here is from a policy paper that we prepared in a response to our review on those strategies that have been published. We also covered the accession countries, but those are not visible in this graph. But as you can see, this is very scattered. So just as an indication for you, green means that one of those indicators that was suggested by the European Council, or by the Council of the European Union, is mentioned and that there are plans for it. Orange means that it's only mentioned, but there's no clear plans for it. And red means no mention at all. And what you can see there is that that approach is not very structural. As I said, even when they are there, the indicators are not binding. And as a result, again, there's a very large lack of progress. This is underlined by the fact that the life expectancy gap, the most recent numbers we have from last year, is that it has virtually not changed. There's been some change along gender lines within the Roma population, but overall, the life expectancy gap is still at 10 years on average in the European Union. Now, this is the problem that we face. Now, obviously, one thing that we would like to do is, and something that we have discussed, but we do not necessarily have concrete plans for yet, is strategic litigation. But in order to be able to do that, to go beyond just individual cases, obviously, we need the policy space to also be conducive to that. So obviously, one of the things that we try to do in that context is political action. So because that legislative space is so limited, we try to put it on the legislative agenda. One example of that is a manifesto that we released just last week from that DISCO network that I was mentioning to you earlier on anti-discrimination and anti-racism in health, where you put a couple of points on the agenda regarding improving that legislative space. recognition of racism as a fundamental determinant of health, for example. But again, if you are interested, I can link that manifesto, and it has those details in there. So that's how we try to kind of prepare the policy space so we can move towards strategic litigation. That already also implies that we cannot limit ourselves just to the health space either, though. When we talk about health, from our perspective, we talk about the social determinants of health, which means that we have to move beyond the health space. We also need to talk about education, we need to talk about employment, we need to talk about housing, and so on and so forth. We are going to try to start doing this work in more earnest next year. So again, not necessarily litigation itself, but the preparatory work for litigation. One example of that is through work that we are going to do with the Office of the United Nations High Commissioner for Human Rights, OHCHR. It's a cooperation that we started last year, or this year essentially. And through that work, we are going to try to, on an even larger scale, so going beyond the EU space, trying to set up that legislative space. And the main work we're going to do there is through so-called General Recommendation 37. And actually, on the left side of the slide there, you can see a picture of Manneken Pis in Brussels, which last week, was dressed up in attire related to the Universal Declaration of Human Rights. So again, this is something that is living in Brussels. So just in very broad terms, and this is work that is based on one of our colleagues at the OHCHR who presented on this at an event we organized in November. So this is not work from me, but this is work from the OHCHR itself. It's based on the Universal Declaration of Human Rights that I mentioned earlier. It's focused on that very normative binding nature of that Universal Declaration, and specifically on Article 2, which focuses on the prohibition of distinction based on race, and on Article 25, which establishes the right to health. And as I said, the instrument that we're going to try to use to ensure that this Universal Declaration is actually actively implemented is through General Recommendation 37, which is on racial discrimination in the enjoyment of the right to health. This is a general recommendation that is under draft now that we're going to work on in 2024. And it's part of the so-called International Convention on the Elimination of All Forms of Racial Discrimination. We are going to be collecting input from civil society organizations for that recommendation. So I also want to already mention here, if that is something that you're interested in, feel free to get in touch with me. My contact information is on the slides. I'll put it posted in the chat too. But if this is something that you're interested in, you can provide inputs to that recommendation, and that's going to be very sort of proactively try to ensure that there's another precedent for member state for countries really across the world, but specifically in the EU as well, that they're going to have another precedent, another encouragement to essentially do practical policy to ensure the right to health. A little side note, an anecdotal side note that we learned about is that, and I think this is not news to you either, is that often it is the countries that are in accession status, for example, North Macedonia, Serbia, Turkey, who actually, at least on paper, do a bit better on the implementation of these because they have to meet these needs to join the European Union, whereas member states of the European Union are already part of the European Union, so do not necessarily adhere to those standards to the same degree. And this also applies to this Declaration of Human Rights. We had examples from Southern America, where there were member states or countries there which actually have legislation on racism and discrimination in health in place, whereas other countries, take the US, do not have that. So that's again anecdotal, but I think it's important to mention there. So concretely, when it comes to this General Recommendation 37, what is going to happen is that, for one, human rights indicators are going to be further developed through this recommendation. They're meant to strengthen the policy tools, so to give clear progress indicators, to encourage accountability so that member states actually, or countries actually adhere to these indicators, and to then with that develop a general human rights system. Again, very broad overview, but that's in very simple terms what the purpose of that is going to be. The structure of that is to first set the human rights standard, so you actually have a basis, a point of departure, to then attribute that right, so to actually highlight, okay, what are the groups that we're trying to cover with that, and then to develop those indicators, so the structural indicators, but also those process indicators, and of course the outcome indicators to set the goal. And this would then help set the stage for strategic litigation. Then we have the tools that we can kind of focus on, that we have the teeth, essentially, that we need to really ensure that we can hold member states to account, that they actually work, that they actually implement the policy that they're put on paper. So lastly, what I wanted to talk about, and again, I'm moving a little bit away again from the health space here, but this is just to give you an indication of what we're kind of thinking about when we talk about this. So what we would like to see, of course, is then a framework in place, a legislative framework in place, along which we can do strategic litigation in health. This is something that, to my knowledge, is not taking place that much yet, which is part of the problem. But maybe some of you might know of some cases in that on a more European level. I mean, not like Eugen was talking about on more national level cases, but in a more structural, really strategic litigation at the European or international level. Two examples that I can give that I've worked, at least am aware of personally, are from Slovakia and Romania. So one is very recent. The European Commission referred Slovakia to the European Court of Justice based on the Racial Equality Directive. It was about discrimination against Roma children at school, so school segregation, essentially. This procedure was already started back in 2015. There was a recent opinion in 2019, and now they've been referred to the European Court of Justice in April 2023. And essentially what is happening here is Slovakia, the litigation is taking place against Slovakia to work on reducing segregation of Roma children in schools based on that Racial Equality Directive, which is a very effective way, hopefully, of forcing action. And again, this is also relevant to health, because we are also at the European Public Health Lines focusing on early childhood development, where education plays a large role. So again, this is not even completely removed from the health space, but again, it's not a purely health-focused litigation attempt, but one example of what we would like to see then also happen in accessing the right to health and in discrimination in the healthcare system, for example, whether we could actually strategically litigate on that topic. And then the other topic that I wanted to mention is in Romania. This is in relation to environmental justice, which again has a very clear link to health as well. And this was based on the landfill directive, which Romania failed to meet. So again, here the logic is that Romania was supposed to close around 68 landfills, maybe more, I'm not sure on the exact number, which it failed to do. This was based on work on the European Green Deal and also on lowering air pollution based on European strategies. So I think when the latest update on this was last year, there were still 42 landfills open. And what is important to mention here is the landfill at Patarut in Cluj-Napoca, where there is a large Roma community that I think a lot of you are probably aware of, that lives on that landfill, which has also extremely negative effects on health. And in that sense, again, this is very clearly linked to health, this litigation case. And so mainly because of reasons of water quality, air quality, the quality of the soil. Again, you can go for quite far with these links. But in that sense, again, this is an example of a case that we'd like to hopefully then also see as an example for health-focused litigation cases. So what I want to kind of say with that is that we need to think outside of the box. So litigation, we're aware that that's a possibility, but it requires action on many different levels and across sectors. As I mentioned, I gave you two examples of education and one on environment, but they link clearly to health. There are precedents there, there's options to do litigations, and that's litigation. And that's something that we'd like to then see more structurally also on access to health and health outcomes. So to very briefly sort of summarize what I talked about, I spoke to you about the competency of health in the European Union, that lies mainly with the member states, that this leads to non-binding policy, essentially. I talked to you about the EU Roma strategic framework, that non-binding nature leads to a very scattered approach and a lack of progress and the inability to actually litigate effectively. I talked to you about how we're trying to address that through political action. I gave you the example of General Recommendation 37 that we're working on with the OHCHR. And I gave you examples of actions of what we would then like to see in the future, more structurally on health and racism and discrimination in health. That we need to kind of think outside the box, that we need to look at a broader theme, but that there is definitely an opportunity there to do something in the future. And that's something that we hopefully, as the European Public Health Alliance, will also be working towards. I'll end it there. I did actually need the 20 minutes that I was allotted. I didn't expect that, but thank you very much for listening to me. I hope it was of use to you. And obviously, I'm also really looking forward to the discussion that we will have about it. But yeah, I'll conclude it there. So thank you very much.
Thank you, Thomas. It was very nice presentation, and it's very important information how to giving. I think for me, for proofs for court and using documents and using some other institution to help our process, in the court, it's very important information to bring in the front of the court and to have to respect it, because it's for all the countries, and it's very important in the court, like litigation strategy. Maybe some of them it's respected and it's adopted in the national legislation, but when it comes to the European level, it's important to have it. So thank you. So now, Darko, I come back to you, and maybe present us COPASAH, the project as well for our context. And after that, we were going to start our Q&A session, and I have in chat some also question about the strategic litigation. I will try to answer on that. Please.
Thank you again. I would, at the end of the part of presentations, I would like to inform you that actually we have as a network, we have available platform for sharing information, experience sharing, resource sharing, and also communication among members. This is I have shared the link in the chat, COPASAHEurope.org. For those organizations that are as members of COPASAH, we can have individuals or practitioners, and also we can have institutions or civil society organizations. Currently, we have more than 23 members, and most of the members are from the Southeast Europe. So if you are interested to be part and to follow to follow our work, you can just click on the join COPASAH Europe and become active COPASAH Europe member, where you will find like a form that should be filled as a part of the application process. Based on the application, the secretariat and also the steering committee members review and approve the membership of each of the applicants, no matter if it's organization, individual, or institution. Thank you very much. I will leave more space for the questions and answers part, and we'll invite all who are present on the webinar to share their questions if they have or need for further explanation.
Okay, thank you. Thank you very much, Darko. So we have now until now, so the agenda, and I will start the Q&A. So Lucian, if you can, will be to make a brief about the presentation of Thomas, and if questions. We start from you, and then I will present a little bit what means strategic litigation when it's to prepare the case until to the European Court. Lucian, okay?
Yes, yes, of course. I just sent a question in the chat, and in which regards the summary on Thomas' presentation, I could notice that he talked a bit about the EU's Roma strategic framework, and this is actually scattered and lack of progress. I know that the EU strategic Roma framework has some objectives due on 2030, and the member states should take into consideration and include the actions in their national Roma strategic framework. Another key point is that the political action and norm setting, and he talked about the general recommendation 37, and also examples of actions, the case from Slovakia and from Romania.
Okay, you want me to read the question?
I think I can do it.
Okay, okay.
My question for Thomas was how member states should act in order to implement the EU strategic framework in which regards the objective related to health. As I mentioned previously, the member states should take into consideration the key points from EU strategic frameworks and put them into the national strategic framework for Roma. So, do you have any recommendations on maybe how the member states should act after they implement after they make their strategies, their national strategies?
I think that's thanks for that question, Lucian, because I think it's actually very, very relevant to what we're talking about today. So when we talk about specifically, but really this relates to all of the specific parts of the National Roma Strategic Framework, so those national strategies. As I said in the presentation, the Council of the European Union gave a very clear list of, okay, these are all of the indicators that you should focus on in these specific sectors in your strategy. So first off, again, to come back to what I said earlier, this is already not being done to the degree that it should be. And because, okay, I understand that some of these indicators might not be relevant. If you talk about halting sites, they might be less relevant for countries in the central or eastern part of Europe, as opposed to the western part where you still have more nomadic groups, for example. I understand that there might be a different need according to the member state, but then still there should be coverage of that in the strategy to mention, okay, this is why we're not addressing, for example, this specific point that the council suggests because so and so. That's already not happening. So that's already one thing that I would like to again see changed, so that all of these strategies actually cover all of those points comprehensively. Then regarding your question more specifically, because that wasn't really an answer to your question, when those are then put on paper, when the member states put those strategies on paper and they do actually cover all of these points, or they at least explain why they're not covering those points, then we need indicators in place. So this is a very sort of like business type way of looking at it, of course, but we do need to know whether member states are actually doing what they promised on paper, but that it's also having the effect that they need. So I know, and we encourage also member states to use the portfolio of indicators that the Fundamental Rights Agency developed for this. So they developed a portfolio with all of these indicators along which you can actually measure that the work that these member states are doing, that those have the necessary effect, so we can actually reach that goal in the case of health, as I said, cutting the life expectancy gap in half. That they actually do that they actually again, it's a bit of a, I think, an unsatisfying answer, because really what I would say there is you have the strategy, you have a responsibility to act along that strategy that you put on paper. If that does not happen, then we should be having a possibility to at least start a case against the member states to force them to actually start doing what they promised they were doing. Again, that's difficult because that non-binding nature is not there. So I think there, again, my answer, very unsatisfying, is that we need to first ensure that when we do these kinds of strategies, that we ensure that they are binding, that there are norms established that member states need to adhere to. Ideally, this should not be necessary, and member states would do it out of their own interest. But we know that that's not really happening across the board. So I would like to see member states follow the plans that they put on paper themselves. If that does not happen, then we need a system in place at a higher level to be able to hold them to account, essentially, which is, I think, also what COPASAH is very strongly advocating for. Very long answer, I'm sorry, but it's also kind of a, yeah.
Actually, I was thinking, and if there is any possibility in order to improve actually the national strategic frameworks, that starting from the litigation cases that you have in terms of health, to build some needs assessment that point out actually the problems, the issues that Roma community are facing, and through advocacy to have a better implementation at national level. Was I pretty clear on that?
Absolutely, yeah, no, 100%. That's clear to me.
Thank you, Lucian, for the question. Thank you, Thomas, for the answer. So we faced this in the national level. So when we started to speak about the strategies for Roma, we have to speak also budgets. And until now, I know the strategy in Romania, it's based only in the European funds, not the national funds. So for that, it's also a big problem. And I think to have a good implementation of strategies, we have to combine the strategic litigation and the public policies that going hand by hand together, because in order to have a strategic case and the government are push it and force it to implement it, something then it become the public policies, how to implement it and how to change in the legislation. So that is very, very important to be together, both. So I will try from the chat to answer about I have 4 questions, and I will going to give you a brief answer. So how we identify the cases? So our cases identified in the 2 perspectives. One is when I told you it become viral, it's in the media and everybody know about, and people from the communities, because from 3-4 years now they know about the Roma Just, and they know about us ensuring to represent them by lawyers in the court. They asking us by activists, by other NGOs, and calling us to the community and telling about that. It's one way. And another way, we have a program to give some, information, conciliation in the community, and then we found out about some cases. And that is another way where we found about some cases related to access to health in the Romanian system. So about standards, it's not important for us if it's only one person, like I was presented, woman delivered in the front of the hospital, or it's for many, like a group. Like Thomas told us about a group from Pataret, we also are involved in that case, but we are involved in the housing care about the demolition where was in to 2012, and the case is still pending to the European Court, and we also wanted to address it that to the Office of United Nations of Human Rights Office, because there is the institution who received the longer time, when it's passed after the incident or the case. To give you the example, so in the national level, domestic courts, we have to go with a complaint. First, we go to the, I don't know, prosecutor. Then will happen the investigation from police. Then after that, the prosecutor give the resolution and going to the court, and the court examine it and give another resolution. Then when it's positive for us, we staying like this. In another way, we going to complain, contest the decision, and going further to the until to the higher court in Romania. And after, when we finish all that levels, we go to the European court. So that is the stages. And for that, we have only 4 months. The European Court is changing now the deadline. We have only 4 months after the final decision from the domestic courts to go to the European Court. But it's possible to have more than 4 months, maybe 5 years, 6 years, 10 years, I don't know. They don't have a deadline, and that is the office from the United Nations Human Rights. Some cases are going there because few cases in the European court level, it's usually about the administrative and the procedural way.
level carefully.
And we're going there with that like a final resolution to have against. So in Romania, I don't know, give you the example for Romania, you can go to the equality body also to complain. That means to find out the discrimination and the criteria was sometimes is intersectional, like to with disability and from rural part and mother with 3 kids. So it's 4 criteria could be. Then you can go to ombudsman also to have a complaint, and after that, to the court. Also, when we speak about the health, the Ministry of Health in Romania have a college of medics, and they receive complaints about malpractice. And another way, it's to go step by step in the court. So the main key and issue to the complaint, it's to understand very well the lawyer what means discrimination and how you give the comparison. And that is very important when it's come about proofs. Maybe we have 2 persons which is put it in different situation, but sometimes it's only one person there, and you have to compare with others, and then it's coming our ability and our statistic and other and other researches, and reports, European level and national level, to give the context how is impacted about discrimination in the community. And many cases which was against Romania have it that proofs took it, because the European Court have it also part of the not only to compare people between them one was discriminated and another was, I don't know, different. So that is it's a very important how you prove that. And preparation of document, it's very easy, and I think it's normal like every case. So we are going to the victim. We take also the power of law for attorney, and then we have the GDPR, and we have all the signature and everything like a contract with our lawyers and association, and starting from there public about victim and all others ethic questions, and we're going to work with them. But I come again to the most important element, and it's how to take proofs about the hate crime, because it's crime, but hate crime, we have indicators, which is coming from OCE and also from Council of Europe, which we can follow from there, and it's very easy to the prosecutor also to respect to find out if it's hate crime or not. So I told you about to prepare documentation. So document is the complaint, then started video, because in discrimination it's allowed to give all the proofs it's possible. I don't know, witnesses, video, because in some cases Indian justice is not allowed to have video in all the cases. So in discrimination, it's allowed. And what is more important, it's changing the proof burden. It's about I said about you discriminate me, and now the equality body asking the perpetrators to prove discriminate the victim. So that is also very important about when it comes to discrimination. Also, that it's a very important document how to prove, and it's important to know about. And the last question, even if the state are not member in EU, we can go to the European Court because it's about the Council of Europe, and the Council of Europe is different from EU, like a state member. So for that, who is in the Council of Europe, like a state member, could apply for the Europe, because many decision also is from Russia, from Macedonia, from other countries which is not in EU. So that it's the all context. It's a lot of work when it's come about the strategic litigation and hate crime. And I think I will finish now with the conclusion about importance, how we can unite the public policies with the strategic litigation and push the governments to have different strategy and how to use better to have impact in the Roma communities. So that was a little bit explanation about the cases, litigation, and the others. And maybe our participants have other questions or comments. We invite them to speak. If anyone wanted to open the mic and speak, or put the question in chat. Lucian?
I do have a question.
Okay.
Maybe could you provide us some details on what happens actually after we have a court decision?
Yes, so after the court decision, like we have now the last one for Romania, it's Lingurar versus Romania. And also we have about mentioning by Thomas about segregation in Albania, it's X versus Albania. So After that, the Committee of Ministers from Council of Europe take the case and pushing the government to give the report what was happening before the case, in the period of the case judgment, and after the judgment, what is the strategy they implemented the decision. And they have a few obligations where you can find it on the site. I will give it to Darko and all the invitation and our group to send it, how you can find easily. So if you go to one decision, Lingurar versus Romania, you can find there all obligation who take it by the government to implement it. I give you an example. So we have very important Lingurar versus Romania because all profiling the police officers and the institution was profiling the community. That is very important for us, because profiling the community is profiling all the members. So, and a committee of ministers, they pushing them to change the legislation, to introduce in the penal code some articles about the hate crime and how not to be profiling the community. Also came the legislation anti-Tsiganism, because it's anti-Gypsyism and when translated anti-Tsiganism in Romania, and also to have trainings with the prosecutor and the police officer how to go and act in Roma community, not be profiling the community. So it's a few recommendations which every state have to implement it and to respect it after the decision. And every year, in 8 months, every 8 months, the government have to give the report what they done in order to implement the decision. Okay, if it's not another question, we have 50 minutes more than our agenda. I will thank for invited. So Thomas, thank you very, very much being with us today and give us a lot of information, and we hope for next year to collaborate more in our projects and strategy. Darko, thank you to helping us to organize the webinar. So I think was a good webinar. If it was recorded, we can send it to our group. And thank for everyone being part in the have time for our webinar. And next year for sure webinar or other activities which you will know from our site, the website, all the events and news. Darko, the last remarks, if you want to.
Thank you, Eugen, for setting the whole agenda and also implementing the whole organization of the webinar. I think that we had very good points shared and also information shared during this 45 or minutes or 1 hour. So we will not end here. I will share with all of you the presentations from Thomas and also Eugen. And also I will share with you the recording of the webinar in order to be able to go back and listen what was already shared in the future. And also we are available as representatives of COPASAH Europe network, and also Thomas from EPHA for further information and clarification if there is a need. You can contact me, Eugen, or Thomas directly, and we will answer. Thank you very much all.
Thank you.
And see you soon.
See you soon.
Thank you. Thank you very much, everyone. Have a nice day.
Bye-bye.
And Merry Christmas and Happy New Year, no?
Of course, as well. Yeah, and to you.
Sorry, Thomas, you have a question?
Oh, yeah, I know the question was just on the webinar, but you said you were going to share it, so it's all
I
good.
will share, but also it will be on the website.
Okay, perfect. On the COPASAH website?
Yes.
Okay,
COPASAH.
perfect. All right.
Thank
Okay.
you.
Have a nice day.
Thank you.
Bye.
Bye.
Bye bye.
Darko, you close, yeah? Okay.